We are beginning to get there now that this lockdown has been successful.
We must stay. Whatever it takes, we will beat the coronavirus, and we will beat it together.
Health Secretary Matt Hancock has reiterated that lockdown will not be lifted until 5 clear tests are met. Now, those tests are ensuring the NHS can cope, number one. Number two, seeing a sustained and consistent fall in daily deaths from coronavirus. Number three, the rate of infection decreasing to manageable levels. Number four, that testing capacity and PPE supply can meet future demand. And number five, here's the key one because it's changed over the past 24 hours, being confident that any changes to the current measures will not risk a second peak of the virus that overwhelms the NHS. Dr Hilary, do you think it's significant that this fifth test has been quietly changed by the government to include the phrase overwhelm the NHS? Some people think that this means lockdown will be able to be lifted sooner.
Well, Dan, hi. It's interesting, isn't it? That subtle change. Clearly, the NHS has to be able to cope with the number of cases that are admitted to hospital. Unless it can do that, we all will be overwhelmed. And I think what they're reiterating is that the real gauge of how successful we're being when we come out of lockdown is, can the NHS cope with numbers? So I guess it's the policy that we've been pursuing for some time anyway, but lockdown has to be eased gently in order to manage these 5 areas.
Dr Hilary, how close are we to achieving these tests?
Well, the NHS is doing remarkably well with a large number of cases, but of course staff are tired. Some staff, as we know, have lost their lives. So we need to bear in mind the levels of tiredness and the levels of capability within the NHS. So far, they've done remarkably well and numbers are coming down. So it's good that cases are coming down and mortality is coming down. So we've perhaps passed the peak and we're plateauing. And we need to keep an eye on that and make sure that we get a sustained and significant reduction in numbers. We are beginning to get there now that this lockdown has been successful. We've got more PPE. Many places have got sufficient, but we always need more, and some places haven't got quite enough, and they particularly need more. We are seeing reduced transmission rates by the look of the statistics. And finally, we feel that we've got better test capacity, which is good. We've got mobile units. We've got units going into care homes with the military. We're carrying on with the frontline workers and people over 65. So up to 25 million, hopefully soon, will be eligible for these tests. So we're getting there.
Well, look, if you've got questions for Dr Hilary, you can message us using the hashtag Ask Dr Hilary on any social media platform. Hilary, before we get into our first question, it is worth mentioning, of course, the fact that care home deaths now will be included in the official figures. So on that note, Carol Lever asks, my mother has recently died from COVID-19 in a care home. I'm finding it hard to grieve as I feel on full alert over the virus. I feel stressed and worried. How can I let my guard down so I can process my mother's death? Well, Carol, huge condolences, number one.
Carol, I really feel for you. It's so difficult to cope with grief and bereavement anyway, but in these circumstances it really is more cruel because it's so difficult to say goodbye to a loved one, and even the funerals are being upset by restrictions to the number of family who can attend. But I think it's important to keep a sense of perspective here. COVID-19, of course, is horrible. It's horrible for everybody living with the anxiety of it all, and I understand how you feel. Your mother was in a care home, so I imagine she was elderly and she may have had pre-existing conditions. And one of the common reasons why we lose our loved ones in care homes is because of infection. Pneumonia is a very common final episode in somebody's life, and most pneumonias up to now have been bacterial and inevitable, I suppose. and if they don't respond to antibiotics. But this virus, of course, doesn't respond to antibiotics. It's very prevalent, it's very transmissible, very virulent. And so we unfortunately can expect to see quite a few elderly, frail people lose their lives to COVID-19 in this pandemic. For you, I think the thing to do is to remember that infections are a common cause of death. COVID-19 is just another one that happens to be circulating at the moment. You need to grieve. It's important to be able to say your goodbyes and to celebrate somebody's life, and keep into perspective that you also have to protect yourself and be sensible and socially distance. But please go through the usual process of bereavement. Think about your loved one, remember them fondly, they're the good times, and hopefully bear in mind that their loss of life would have been not cruel, not in an aggressive hospital environment, but in a caring, sympathetic area in a care home where the staff were caring for her and loving her on your behalf.
Yeah, condolences, Carol. Thank you for writing in. Our next question is about high-risk children, Hilary, in schools. Before I get to it, do you think after the reports this week about this new syndrome affecting kids that parents need to be even more worried?
I think we need to keep the latest news about children being affected by a new syndrome in perspective. We're talking about a small cluster of cases. We don't really know if it's COVID-19 related either. But what we're saying is that if you have a child with a rash or with tummy symptoms, it's highly unlikely that it's part of this new syndrome that's being reported in paediatric units. It's much more likely that they've got an ordinary upset tummy due to some other circulating bug, which is much more innocent than COVID-19, or they've got a rash due to a medicine they're taking, or to hay fever or some other allergy. But small number of cases. Keep things in perspective. I would say this: if your child is very unwell, and if they have tummy pain or diarrhea or other symptoms you can't explain which isn't responding to normal treatment, then call 111, go online to 111, or talk to your GP for further advice.
And on that note, Penny Richards asks, if you have a high-risk child, what will happen when the schools reopen? Will they still have to isolate?
I think it's likely that when we see this phased lockdown in time that people are talking about, that anyone of any age who's in a high-risk group will probably need to self-isolate for a little bit longer until we see what happens after lockdown, until we see what's happening to the number of cases that we're seeing, till we see whether the NHS can cope. But if you're high risk at any age, it seems sensible to just be playing on the side of caution, staying away from school where the virus could be circulating, and just being putting your health first and being extra cautious. I know most children would want to go back to school, but it's a place where the virus could circulate. So I think high risk, stay home a bit longer, and I think that's what the advice will be.
Stephen Garnham has sent us this question using the hashtag Ask Dr Hilary.
How does the Chief Medical Officer know the R value is below 1 when none of the general public have been tested? And furthermore, is it likely the general public will be tested in this fight against this virus?
Well, the R value, of course, is the reproducibility of the virus. How many cases are passed on from one person to others? And if one person passes it on to one other person, the R is 1. We want it lower than that, so we're reducing the transmission and the number of cases. How will we know? Well, we'll only know by testing. And of course, you're right, the general public may not have access to tests, but we're increasing the numbers of tests so that anyone working away from home, if they get symptoms or if their family members get symptoms, they will be tested. And so will people over 65, and so will people in care homes and the staff in care homes. So gradually we will be building up a picture to see, as we do more tests, how many people are being infected by other people. And that will give us an idea of what the R value is, and whether the lockdown measures have exceeded what we should have done, or whether we can go further.
Great answers as ever. If you want to ask Dr Hilary a question, you can use that hashtag Ask Dr Hilary. You can go to thesun.co.uk/Dr Hilary, or you can submit your question on talkradio.co.uk. And Dr Hilary will be back tomorrow answering more of your queries and Ask Dr Hilary Coronavirus Explained.